Up next, we have Joseph Strauss. Joseph is a licensed architect with over 40 years of experience, specializing in healthcare facilities planning and design. Project experience has included campus master plans, new major patient care, clinical and education buildings, uh, small clinics, behavioral health facilities, reuse of historic buildings, and numerous renovation projects. He is a member emeritus, American Institute of Architects and the American College of Healthcare Architects, and a frequent speaker and panelist on healthcare facilities planning and design. Now, with empathy, a driver for healthcare facility design, here's Joseph Strauss. Joseph, take it away.
Thank you, Brian. Good afternoon, everyone. A few years ago, the Cleveland Clinic embarked on a journey to cultivate a culture of empathy. We're going to take a look at how that was done. First, we're going to take a look at how the culture was shaped and then how it influenced the design of its facilities. Do we have the slides up, Brian?
I see them in a smaller window. I just don't know if they're on the live stream. So
no, I see them in the small window.
They are. If you hit speaker view on the top, they'll go full screen.
There you go.
To the top right.
Yep.
So are they full screen?
Yes, sir. Yep, if you see it in that little window, you're good to proceed.
Oh, okay. All right, good. Thank you.
Thank you.
The clinic is a large healthcare system based in Northeast Ohio with a presence in Florida, Nevada, and 3 international locations. A survey was done to see how the clinic was perceived. Clinic leaders were asked, when it comes to patient experience, what do you think patients value most? These are the leaders' thoughts: new facilities, quiet time, private rooms, food on demand, bedside computers, and liberal visiting hours, all very tangible items. Then patients were asked what they valued most. Their response was very different. They wanted the staff to listen better and to be more empathetic. Wow. The difference in perceptions was a wake-up call to Dr. Cosgrove, our CEO. So the transition began. Patients were always first. Doctors were next in priority, then nurses and everyone else. We realized this did not create a collaborative environment with open communication. A significant change was made. Patients were still the top priority, but then the organization moved to a team concept. Everyone was considered a caregiver. As we say in healthcare now, healthcare is a team sport. The patient experience strategy was developed. This included new leadership positions and extensive education. It included a chief experience officer. The answer to that question is yes. Over 40,000 employees participated in learning sessions. Tables of 10 with a mix of doctors, nurses, food service techs, lab techs, facility maintenance techs, etc., participated. We learned how to be empathetic and how to convey empathy. Now we'll take a look at the design response to this cultural change. I have a short 3-minute video that should show better than I can explain why empathy is important. I've watched that video many times and I still get emotional when I see it. If you're interested in it, it's available on YouTube under Cleveland Clinic Empathy video. Our overall goal was to create a calming environment. We felt that was important. An environment that is uncluttered and free of visual noise. We wanted to make the patient feel that they are getting the best care possible. You will see how this is translated into a very specific design aesthetic. We did research and used a number of different methods to form facility design. I won't go through these, but you can scan them on the screen. I have a number of slides that show several facilities designed to support the patient experience and the culture of empathy. I'm going to scroll through these quickly and make just a few comments as we go through them. Let me first point out here that the goal of creating a calming environment begins when you enter the facility, before you enter the facility. Here you see a tree-lined alley with gentle pools of water as you approach the main entrance to the main campus in Cleveland, hopefully reducing stress before you arrive. And now just a couple shots, interior shots of that building. This is the new major addition to the clinic's Hillcrest Hospital. There is an extensive use of glass to brighten the interior and take advantage of views. White brick is used to give the building a feeling of lightness. This is Avon Hospital, a new 120-bed community hospital built from scratch on the west side of Cleveland. The interior is simple and clean. Light oak wood, white walls and ceilings, classic contemporary furniture, light gray flooring, and extensive use of glass. This material and color palette is used consistently throughout the clinic facilities. If you've been in other medical facilities recently, you probably saw a very different aesthetic, probably a generous use of materials, colors, textures, patterns, and extensive signage. This is the Avon Family Health Center, an outpatient facility. And this is the Twinsburg Family Health Center, a sister facility, if you will, to the Avon Family Health Center. As a note, all these facilities are designed by different architects engaged by the clinic, but the clinic staff really set the standards and directed the design of these. And we had some really good participation with the architects, and they all loved doing these buildings with us. Here's a good example of how we brought nature into the building. And then finally, the new cancer center on the main campus in Cleveland, and some interior shots. This is the Cancer Center's Patient and Family Learning Center. Extensive use of artwork in this building as well as other ones. Approaching the meditation room, the cafe for visitors and staff. And my last slide, a private patient infusion room, which is very comfortable, and you can see the view out the window there. Thank you very much.
Thank you, Joseph Strauss. That was, I know as presenters, I couldn't hear audio from the video, but just even the visual of it was very stirring. And I thought it was an interesting contrast to the way designers think between, Rebecca's presentation on building excitement and how yours focuses on building that calm. And so it's, about getting the right design drivers. It is about empathy, about taking some of that anxiety away from what is not usually considered a good experience. So I thought that was very remarkably well done. very stirring. So thank you very much.
Thank you.